I chose the role of a system analyst for a possible future career choice after I graduate with my HIM degree. A system analyst definitely goes along the technical career path of HIM because you're dealing with computers and analytics. And I've always wanted to work in the healthcare field, but not so much direct patient care, so more alongside of the business aspect of healthcare, which system analysts deal with. System analysts are definitely a vital link among providers, payers, and patients because there is so much that goes on in between each one of these people and how they communicate and how the data is getting from one person to another and how everything and everyone's information is getting passed along. And this has to deal with insurance coverage and what the doctors are willing to pay and what not, and just all of the medical things that the patient got done to themselves and their electronic health records as well. They also manage computer information systems to overall improve workflow and business practice in the healthcare world, and their tasks include collecting and analyzing data, testing new workflow applications, and organizing audits to make sure everyone's information is getting where it needs to go. And the healthcare world is always enhancing with its technology and advancing, so this system analyst is always doing more electronically. You're working alongside with the HIM operations, the coding team, and clinical documentation improvement, while you're also working alongside providers, credentialing, patient access, and patient financial services. So the skills needed for this job are you need to be very proficient in written and verbal communication, analytical problem solving, and knowledge of relevant computer systems. Because of how many people you're dealing with, you have to be able to talk to them, communicate with them to make sure everything's getting across. To gather more information on a career like this, I interviewed Abby Warndorf, which is a recent grad of HIIM here at WVU. So she was very familiar with this class. She's taken it before and just HIM in general, and she gave me a lot of information. And she is an associate system analyst for WVU Medicine now, and overall she said it was a lot of teaching and training. Abby went on to share what she does during the week, and she says it really varies day to day what she's going to be doing because of how much she does. So some days she trains medical students on how to use Epic, and these classes are 4 to 8 hours long, so they're very long classes on how to use this medical record system that WVU Medicine uses for their patients. And if she's not doing that, then she's preparing go-lives at other hospitals. She does different mini projects. She says she has a ton of emails that she answers a day, and she also attends a lot of meetings. She is part of the Epic Provider Training Team, and she works alongside a team of 20 members and works closely with 3 to 4 members a day. And she said that this job is a really good starting job for her, and there's so many advancements that she could make later on down the road. To be an associate system analyst like Abby, you need to have a bachelor's degree and a preferred degree in health information management. That's like the best degree to have. You could have a science healthcare degree, or maybe even minoring in computer science, but HIM is definitely the best. A master's degree is not required, but it could help you just with salary range and just make you better than other competitors that want the job too. And you need several years of experience and training, but with an associate system analyst like her, that's a start out job. She went to WVU and graduated with her HIM degree. You don't need any certifications to be an associate system analyst, but you could get a proficiency in Epic as you move along up and become a system analyst or a senior system analyst. Your salary can be increased if you obtain your master's degree later on down the road, but an associate system analyst makes around 60,000, a system analyst makes around 90,000, and a senior system analyst makes around 100,000. And obviously this varies by your degree and certifications, qualifications, and the area in which you're working. Some areas make more, such when you look up, California is one of the highest paid for this career. There are a lot of ways to advance within this career in HIIM in general. This job specifically is projected to grow 7% faster than other jobs in the next 10 years, so it's a really good field to get into now. And we are moving and advancing towards a more integrated electronic health environment, so this is going to be a very needed field. There are endless opportunities and ways to make advancements within this career, even if it's going on to get your master's or to receive a certification. You can always move on up to higher positions and just overall make an impact. Some insights I learned from Abby and just from researching other people in this profession are to follow your dreams, and nothing is impossible within this career. And self-confidence is major. And having a positive attitude is also a key, along with communication with others because of how many people you're dealing with.